Welcome back, IELTS learners. Health is important to our overall well-being and quality of life. And yes, health is also a common topic in the IELTS test. It frequently appears in all sections. So today we are going to be looking at some important vocabulary around the topic of health. To make it a bit easier, we've sorted the topic into 4 different sections. To begin, we'll have a look at medical conditions and symptoms. Next, we'll look at healthcare professionals and facilities. Third, we'll look at healthy lifestyles and practices. And lastly, we'll be looking at vocabulary around public health issues and healthcare systems. So let's dive in with medical conditions and symptoms. First up, we have symptom, a sign or indication of a disease or condition. One common and uncomfortable symptom of the flu is having a high fever. Next, we have diagnosis, which is where a disease or condition is identified by a doctor. After conducting several tests, the doctor provided a diagnosis of influenza. Third, we have treatment, the medical care given to a patient for an illness or injury. The treatment for her arthritis includes physical therapy and a round of strong medication. Chronic is used to describe a condition that lasts for a long time or keeps coming back. Living with chronic pain can significantly impact a person's overall quality of life. A condition that comes on suddenly and is usually severe can be described as acute. She was quickly admitted to the hospital due to an acute allergic reaction. An adverse reaction by our immune systems to a substance is known as an allergy. He really should be carrying an EpiPen at all times due to his severe peanut allergy. Next up, we have healthcare professionals and facilities. Doctor. The doctor advised her to have further tests. Nurse. The nurse administered the medication. Nurses are often highly trained professionals who provide care and assist doctors. Hospital. He was rushed to the hospital after experiencing chest pains. Clinic. A clinic is often a small medical facility for outpatient care. She visited the clinic for her annual checkup. Emergency room, or often abbreviated to ER and called the ER. They quickly rushed me to the emergency room. Specialist. A specialist is a doctor with advanced training in a specific area of medicine. She was referred to the ears, nose, and throat specialist. Thirdly, we have healthy lifestyle and practices, something that a lot of us love talking about. Exercise. Regular exercise, such as jogging or swimming, can improve cardiovascular health. Diet. A balanced diet rich in fruits and vegetables is essential for maintaining good health. Nutrition, which is the process of obtaining or getting the necessary food for health and growth. Nutritionists emphasize the importance of getting a variety of nutrients from whole foods. Hygiene. Hygiene are the practices we have to maintain health and prevent disease, especially through cleanliness. Proper hygiene practices, like washing hands frequently, can prevent the spread of germs. Immunization. The process of making a person immune to a disease, typically by vaccination. Childhood immunization programs are designed to protect against preventable diseases. Stress management. This is one that is often used not only in the healthcare field, but also in business. So it refers to techniques to control and reduce stress, something that everybody suffers from time to time. She practices yoga and meditation as part of her stress management routine. Lastly, we're looking at public health issues and healthcare systems. First up is epidemic, which is a widespread occurrence of a disease in a community at a particular time. The government implemented measures to contain the spread of the flu epidemic. Pandemic. Well, we've all had recent experience of this. The COVID-19 pandemic has had far-reaching effects on global health and economies. Next is health policy. So these are the decisions, plans, and actions made to achieve healthcare goals. The new health policy aims to improve access to affordable healthcare for all citizens. Prevention. Measures taken to prevent disease or injuries. Very useful. Preventative measures such as regular screenings can detect health issues early. Awareness, knowledge or perception of a situation. Health campaigns aim to raise awareness about the importance of mental health. And lastly, access to healthcare, something that you'll see written across many forms of media, which is the ability to get and use healthcare services. Improving access to healthcare in rural areas remains a significant challenge, and we all know that that is true across many countries. So there we have it, 4 groups of words that are going to help you engage with the topic of health in preparation for your IELTS test. We wish you the best of luck. See you in the next video. Bye bye.